Welcome everybody to Lunchtime with Hooten Family Healing Center. I'm Dr. Brian Hooten, and I'm with the lovely Christine Rhodes, who is pregnant. And when do you do, Christine?
August 19th.
August 19th. So we are smack dab in the middle of dealing with pregnancy hormones, and that's what the show's all about today, is hormones. And I think if we polled 100 people, any 100 people that you know, 90 of them know that hormones are a big deal. One of the most often prescribed medications nowadays is for hormone issues of any kind, whether it's your thyroid or female hormones or male hormones like testosterone. You see it everywhere. So we've got a lot to unpack today. We're going to go through hormones as adolescents, when we're teenagers. Even hopefully we'll get to some childhood, even 5 and 6 year old hormone issues, all the way up to when we're 18, 19, 20, later on in our 20s, our 30s. And hopefully we'll get to, late stage hormone issues, because that's a big thing, especially with older women and guys losing their testosterone. It's just everywhere. So we're going to get right into it. So Christine has a great history, thankfully, because she's better today, but it wasn't always great for her. So Christine, why don't you give everybody a little history, like when did you first know you had hormone issues? Even if you didn't know that's what it was, but
I would say when I started getting my cycles, they were horrible, painful, would keep me in bed, but I thought that was normal. I thought periods just sucked for everyone.
So keep you in bed for, I'm a guy.
Cramps, just painful.
And so you're in bed all day?
It definitely stopped me from doing things, coming and going.
So
if I had plans, they were canceled.
So when you're hurting like that, obviously your parents take you to where?
The doctor.
What type of doctor?
OBGYN, just your normal family physician, whoever.
Maybe even your pediatrician, right?
Right, yeah.
And what is the standard care treatment from the doctor?
Birth control.
Okay, so let's unpack that a little bit. They give these young women birth control pills to what?
Many reasons. To help with the cramping. They even use the excuse to help with acne nowadays a lot.
Oh gosh, yeah, to stop the effects of the cycle.
Mm-hmm.
So the cramping,
mm-hmm.
and obviously the pain.
Mm-hmm.
How about to stop the flow or to slow the flow?
Mm-hmm.
And let's just pretend that people watching this, by the way, if you haven't done this already, this hormone thing is such a big deal. You'll help somebody out there a lot by sharing it. I really appreciate that. Click the like button. Show us that you're watching, hit the heart thing and all that. Really share this. It'll help people, because how many young women go through hormone issues when their cycle starts?
Probably everybody.
A lot of them. I mean, I would say the vast majority. I know my wife did too. So they give you this birth control pill. So the birth control pill is actually what? Do you know what it is?
No.
So people don't bat an eye at this. The doctors, here's your birth control pill. It's actually estrogen, and typically it's an artificial form of estrogen. God knows where they get it from. Side effects of estrogen therapy, public knowledge, if you want to go look this up, include, do you know what that includes?
Not specifically, I don't know.
Breast cancer. It raises your risk of breast cancer. So when you're 13 years old, what if they'd have said to your mom, hey, here's this birth control pill, it's estrogen, it'll help the cramps, it'll help the pain, and probably stop the cycle, right? It actually stops the cycle if you take enough of it?
Depending on what they give you. There's so many options, it's insane.
The side effects include raising her risk of breast cancer later. Did they tell you all that?
Of course not.
No. What's the other side effect, do you know? Strokes. Increased risk of strokes. And they start this routinely at 12, 13 years old for these girls. It is a catastrophe waiting to happen. So they didn't tell you that. Now, as you age, you went through your teenage years. Mm-hmm. How long did you take this thing?
I started birth control when I was 18, and I took it until I started working here about.
Okay, so at 13 and 14, your cycles were okay?
They were all right.
And then they started getting painful at 18?
Yeah, I would say so.
Gotcha.
I didn't know better. I mean, how do you know better? How do you know what they're supposed to be like?
But at 18, you were miserable. So
I was miserable, yeah. And then I found out there was options out there. I could take something to stop it, so I jumped at it.
What was that?
The depot shot.
Ooh. And how often did you take the depot shot?
I was on it for at least 5 years. You did the shot every few months, and you don't get a period at all, which I thought was an amazing thing. Why would not every woman do that?
And that's fair.
Yeah.
I mean, who wants to be
until I
miserable?
realized, until I gained 45 pounds, depression.
Okay, so let's unpack all that a little bit. See, cycles are a normal thing, and your body's trying to go through all these different changes as you develop and age. You'd actually be better off not taking anything and then dealing with the side effects of these things. But I totally sympathize. I mean, we get people in here all the time who have just been miserable, whether or not they're taking the pill. A lot of them took the pill for a while and then stopped, and they had all these other issues building up. We're going to get to that in a little bit. So you went through the depot shot, didn't have a cycle for, you said 5 years?
Basically, I maybe had a couple periods, if that.
And we met after you were doing that for about 5 years, right?
Correct. I was on the depot shot, and then I switched over to birth control. You only have a period 4 times a year. So I thought it'd help with not gaining weight. Same thing. Didn't matter.
So you guys know how I am. She comes in here, we hired her, and she's telling me all this stuff. Were you still taking it when we first met?
Yes.
And I freak out. You know what I mean? I was like, because I care. You know, I don't want you to kill yourself while you're trying to cover up this.
Well, I was terrified to go off of it.
There you go.
Yep.
And you know they do a good job of scaring you. And you do. And why were you scared?
I was afraid it would be a horrible comeback of my period.
Yeah.
Now,
yeah.
I stopped it for so long. Just wait, what's going to happen now?
You were taking it for so long. So if you stopped, what would happen? So you start care here, which included, what was the first thing that we did?
Got x-rayed, saw what's going on with my spine, and got adjusted.
So let's talk about that a little bit. So, well, first of all, how were your cycles when you stopped? When you stopped the pill and you started doing all this?
They weren't great just because I wasn't used to having them, but they evened out. I mean, I was able to deal with it.
They weren't awful.
No, not compared to. I wasn't canceling plans to go out because of it.
And then you got married.
Yeah.
And how fast did you get pregnant?
Immediately.
Okay, so which is great news, but we're going to talk about that a little bit. So she had hormone issues since you were 18 years old, and taking that depot shot. I mean, things were, safe to say, on the inside really screwed up. So you come in here and I say, we've got to do everything to get you to where you don't need to take that, and set your, because had you continued that, pregnancy would have been even worse, and they wouldn't. I know the beginnings wasn't fun. So what did we do? Well, the first thing that we did, and the first thing we would do for you, is start educating on how your body's supposed to work. So it has to do with your mind. So instead of looking at your hormones as the problem, that is actually the symptom of an underlying cause. So we come in here and we start taking x-rays, but the first thing I want to tell you is that, look, your hormones are trying to be normal. You're not programmed. God didn't make any of you to start having these horrible cycles, to get endometriosis, to have PCOS, whatever the case is. You are designed to be healthy. You're designed to heal. So that's the first thing we take everybody through. So instead of me, I didn't just beat you up mentally over taking this stuff. I just like, look, you don't have to rely on this stuff to be and it's causing all these other side effects. Let's get to the root cause. And that's where the x-rays come in. So it all starts with the health of your nervous system. Period. And that is a consistent message that we share with everybody. And think of it logically. If your brain and your spinal cord and the nerves, your nervous system, if your nervous system is not communicating to your hormone factories, including your thyroid, including your ovaries, and all, and guys, including our testes, and all these different parts that have there's 84 hormones in a crazy dance. Your fat cells actually make some hormones. I mean, we could talk about that for hours and hours, but just know that there's so many things going on with your hormones that we've got to get your body working right so that it can sort itself out.
Right.
So that's the first thing we did. We took the x-rays, and do you remember what was going on with your x-rays?
My neck I had a reverse curve. It was going the other way.
Yeah, so instead of having a natural, normal shape to her neck, it was clearly evident on the x-rays that it wasn't anywhere close to where it was supposed to be. And what that does is it restricts the flow between your brain and your body.
Right.
And did you know prior to seeing us that you had a problem in your neck?
No idea. Not a clue. Why would I have even thought of that?
So you didn't feel it?
Right.
So what we're talking about is on a level where you probably don't feel it, but if your spinal cord is restricted, think of a water hose getting choked between the water faucet and the garden. If that is getting choked or restricted, even where you don't feel it, what happens to your garden, obviously? And in this case, what happens to your hormone system and all the delicate things that go into your body balancing out your hormones? It can't work right. So you have to start there. Now there's other factors, aren't there?
Yeah.
So just to finish up on the spine part, you have to be getting proper chiropractic care. What does that mean exactly? You want to find a place, and you can call us, reach out to us. We'll get our phone number. We'll just look below on Facebook and on YouTube. We'll put our contact information. And you can reach out to us through an email, through a phone call. We'll help you find somebody that knows what we're talking about that can help you through this. Because not all chiropractors are the same, obviously. In fact, less than half of 1% do this kind of work, where we focus on getting your spine flowing from your brain to your body. So that's the biggest thing we did for her, and you heard her. Your cycles,
they got much better.
Really quick.
Really quick, yeah.
And you and John got pregnant.
Really quick.
Just like that. So Christine is not alone. Listen, when I met my wife, Mish, many of you know her, she was having awful cycles too, and she wasn't taking the birth control pill, thankfully,
right.
And she had, honey, if you watch this, I love you dearly, but she was having a little trouble cutting some excess lipose tissue. She was a little more chunky than she wanted to be. So we started working on her spine, and she was already eating great, and her body sorted itself out. And if you've seen her lately, she is just a one hot mama.
Well, can I mention how much weight I lost?
Please do.
I lost 20 pounds in 3 months, just getting adjusted, just doing what I was the right way, doing what I was supposed to do.
So did I take that weight off of you?
No.
How did you lose the weight?
I started taking care of my spine, eating healthier, and being more active in general, working out.
So your metabolism, which is obviously lots of hormones involved in your metabolism, like insulin and cortisol and all that, those started working better, and you started losing some excess baggage. Good stuff. Okay, so let's unpack some of this. So first of all, just know that you can. And if you have an extreme case out there, we have one lady who's a good friend of ours, and she'll probably see this. I won't call their name out, but she came in here with endometriosis and had several surgeries for cysts all over the place, and the endometriosis, I mean, just listening to her story was a disaster, and they couldn't get pregnant. They had gone to fertility specialists for years. If I remember correctly, it was like 6 years they'd been going. So well, she started care here and got her brain and her body work, and the endometriosis settled down. All those cysts were either they're gone or just not bothering her, and they now have 2 little babies. They're doing awesome. So even if you have a big extreme case like that, or let's say they have removed organs, let's say you've gone through a partial hysterectomy or something, or your thyroid is missing. Well, understand this, your body is still trying to be as healthy as it can. So if you get your brain and your body connected better, would that help you?
Yeah.
And the answer is, of course it would. Even if you can't heal all the way because an organ has been removed, or, like Thomas, what's up, Thomas? I know you're going to see this, was taking a thyroid hormone for, 15 years or something. He was able to come off of that, no problem. If you've been taking a thyroid hormone or some other type of hormone medication for 20 or more years, and you're 50 or 60 years old, okay, look, healing is going to take time. Your garden still tries to get well once you reestablish the water supply to your garden. Your body still tries to get well. It may just take a lot longer. And even if you can't get all the way well because there's not enough time, you'll be better off with your brain and your body work. Because that's what we tell some people that have been taking these drugs forever. At least we'll get you as good as you can so you don't get worse.
Right.
Because if you don't do anything,
nothing's going to change.
And we just had somebody in this week. How many medications was that sweet lady taking?
20.
20. Because the system is set up, the doctors are set up.
She thought it was normal.
Yeah. The doctors are set up to give you more drugs, and they brainwash our culture into thinking that taking these medications are normal. So I want to touch on that. Hormone replacement therapy, the pill, testosterone injections, and pellets that they're installing in people, like a robot or something. That is not a solution. That is a temporary cover-up with massive side effects. And just for testosterone talk, when you start artificially putting testosterone in, there is a chain reaction that starts up in your midbrain. I won't get too technical, but they're several organs and parts of your brain that are involved. And if you start artificially injecting testosterone, this whole testosterone factory will shut down. You'll start converting even the artificial testosterone into estrogen through a process called aromatization, if you know anything about it. Now, some of these people, they get on these testosterone therapies and they feel great for a little bit. They start, getting stronger again. They'll get erections again and all these different things. But it is a temporary solution.
Right.
And they're robbing Peter to pay Paul. So even if you've done something like that, listen, we're not judging. What I'm telling you is if you get your brain right, your brain and your body connected better, at least your body will start correcting itself as much as it can. Now let's go through some of these other ones. So know that you can. Minerals. So a good mineral supplement. Are you taking your minerals regularly?
Yeah. Yes.
This is the big part of it. Just an example, your thyroid hormone, thyroxine converting to T3 and T4, your thyroid function heavily depends on iron. These are some little bitty details that we forget about in school or maybe you never knew. And I'm not telling you to go run and take a whole bunch of iron. What I will tell you is that minerals are needed for almost all, if not all, of your hormone function. Whether it's estrogen, testosterone, thyroid, or cortisol, or leptin, or anything you could think of, you need minerals to make the interaction work. Okay, so a good mineral supplement, we carry a liquid mineral from Constant Trace. Is the brand. You can get that at just about anywhere, any natural health food store. You can order it online. It's a blue bottle, and it's trace minerals. So just in that, you know what? Do you remember why people are low in minerals? I'm kind of putting her on the spot with this question. Because our food supply has been depleted for the last 100 years, ever since industrialization. And we live in a concrete jungle here in North Texas. You don't see a whole lot of organic gardens.
No.
Going in fact, we're a stone's throw from 6 fast food restaurants, which have very little mineral content of any nutritional content.
Right.
So adding a very clean mineral source will radically help your hormone. In fact, it'll help everything. And then obviously cutting out sugar and processed carbs. This is all over the place, guys. If you're still eating sugar and processed carbs, what are some examples of processed carbs? In 2018, I'll ask people, and Christine's going to know, but I'll ask people that come in here and they don't understand what a carbohydrate is. Do you know? It's a processed carb.
Like bread?
Bread. Mm-hmm. Yeah, white bread. What about packaged wheat bread?
Yes.
That's definitely. Is there a safer kind of bread?
You've mentioned one before.
Yeah, Ezekiel is a good brand. However, if you're struggling with hormones and weight and all this, I would even recommend you cutting out the healthy carbs, even the fruit, for a short time.
Which shocks people.
That's very shocking. As far when it comes to nutrition, we've been doing a hair tissue analysis, which I mentioned down here. A hair tissue analysis here lately, and it has uncovered some shocking things. So one young lady, for example, is 50-ish and lovely and hairdresser, and has been losing her hair and hasn't been able to grow hair on her legs for a while. Well, she's also very thin, so we've been having her on a healthy dose of healthy fats, proteins, and clean veggies. And I know these people. I know they're eating well, and she's trying everything. Yeah. Well, we did this tissue analysis, and her body isn't processing fats properly. So we, overnight, we eliminated fats, the excess fats. So now remember, this is an example of somebody we did a tissue analysis on. Fats are very important. You need fats. Your hormones are made from fats. In her case, she wasn't digesting the fats very well, and it was causing an immune response throughout her body, and things were going haywire. So she cut out the almond snacks and the extra omegas and all the extra fats that she was taking, and she started feeling better overnight. So we're a week into this whole thing, and now she's feeling her hair grow on her legs already. So to really get detailed about what you need to eat, this hair tissue analysis, that gives us like a 3 to 6 month window of what's been going on in your body, any mineral deficiency, any vitamin deficiency, any food intolerance that you're having. It really helps us tailor it. And
I found out a ton of information.
What was yours?
I was very low on sodium, potassium, magnesium. It explained a lot.
Some really important things.
Yeah.
And were you a little bit moody in the first part of your pregnancy? There's a little bit, and we've seen it. So it's been a couple of weeks since you did your hair analysis, and I'll always see her smiles now. So we're grateful for that. We'll tell you that. Okay, so the right type of chiro, we talked about that. Look, if you don't live in the North Texas area, you can reach out to us. Please do. We have a network around the world. The majority of us are in the States here, but if you don't live here in the North Texas area, we can help you find somebody. Max Living is the name of our group, MAXLIVING. But if you're anywhere in the North Texas area, we get people driving in from hour and a half and 2 hours here. And if you have family that lives in Oklahoma, for example, or Colorado, I mean, you had to look up somebody the other day. Remember where it was?
I mean, everywhere people are always asking.
Yeah, so
we have current patients. Hey, North Carolina.
Florida's where you had to look up. Yeah. Tampa. I mean, we got them everywhere.
Yeah.
Okay, so then tissue analysis. So healthy fats. Now, pretty much most people can get away with adding more organic veggies to their diet. So if you have like constipation issues, if you have an irritable bowel syndrome, if you just go and throw a bunch of broccoli in one of these real high fiber foods, that might bother you a little bit. So you may need to do a lot of juicing. But that'll get some nutrients from the veggies that'll really still help to, just give your hormones and your brain and your heart some really high intensity nutrients. So what's the hardest thing though people have to do? They have to cut out the what?
Carbs.
So you have cutting out the sugars. You know what? I get it.
Yeah.
I get it. You probably have heard that. This may be hard. I'm tempted, just like
it is hard.
we came in the other day and she had cracked, and not to embarrass her, but she had some food that shouldn't have been eating, so we had to go get her some good stuff. Look, we understand that that's going to be difficult. At least throw in some good stuff.
Right.
At least start eating some organic veggies. Now, that word organic is very important because our food supply is full of pesticides. Down here where I talk about chemicals, pesticides wreak havoc all over your hormone factory. Basically the hormones will collect like a magnet. They'll collect these chemicals, and then so when one hormone tries to interact with another, it just bounces off and creates an immune response, and inflammation ensues, and this whole chain reaction through all your hormone system just goes crazy. So you want to get an organic food. Now, to touch on these chemicals, in your food that you eat, protein, and if you eat out at a restaurant, listen, if you don't eat organic food, you're getting a bunch of chemicals thrown into that food. And if you really dig into this, like if you wanted to educate yourself on what foods have the most chemicals, just start searching online, safe foods, safe restaurants. We have a couple of excellent choices around here, which...
my favorite's Liberty Burger.
Liberty Burger. And that literally is in between my house and the office.
Yeah.
Yours too.
Yeah, it's right here.
So we eat it regularly. They have some clean meats. They have really clean options. Another one is Chipotle.
Of course.
Just when you go to Chipotle, try not to eat many tortillas. All right, because that's a processed carb. But their meats are cleaner.
Try to stay away from the chips too.
Yeah, the chips. When I used to eat chips, you put one basket in front of me at a Tex-Mex restaurant, and it was over. So now when we go, we don't get the chips.
Just don't even look that way.
Yeah, they go to put them down with that hot sauce, and I say, take it back. So that's a good tip. And listen, guys, I've conquered this. You can. Yes, you can. It may seem hard. Yes, you can. Okay, so let's get to a couple of these other ones down here. Now, these may seem sneaky. Some of these chemicals, like your deodorant, your toothpaste, perfumes, household cleaners. Can you think of any other chemicals?
Sunscreen.
Yeah, sunscreen. We talked about that in a previous video. We're in Texas, so you got all this sunshine. And if you think about shampoos and household cleaners and deodorants, and you look at the ingredients label on these things, I mean, you've got all these words you can't pronounce. And years ago, I would take these labels and I would go through and look up what each chemical meant. I don't know, I'm kind of a nerd like that. And you would find that some of these chemicals have a cancer rating on them.
Scary.
Yeah, there's one word, benzoate, which just look that up if you don't believe me. I mean, yes, some of these things occur in nature, but when you take those and extract them out, so now they're in what we call an inorganic form, so your body has no idea how to process it. It'll break down and cause things like cancer. It's hormone disruptors, plastics, these phthalates, they're all over the place. Look, I could go through a list of all these chemicals. and people's brains start to explode. You know, oh my gosh.
Yeah.
I hear it everywhere, doctor. Anything causes cancer nowadays. Okay, look, instead of blowing your head up, let's just start thinking, how can I clean up what I'm doing? Deodorant and toothpaste are so easy. You don't even have to go buy some special brand if you don't want to. You can make your own. Right now, I'm using coconut oil by itself and a drop of essential oil, lemon. All right, and my teeth feel polished. And that is what I use for toothpaste. Now my wife has some organic, natural teeth whiteners. So if you want to get into toothpaste that are organic, you have to go look for those and spend a few dollars. You know, they could be $10. We have one that's here.
Thieves.
It's a Thieves-based toothpaste. There's no fluoride. Fluoride is a massive destroyer of health. Yeah, that's right. Anything with fluoride, you need to get this out of your body. I could go through a laundry list of what it does to your hormones and every other cells. If you come to our cancer workshop, I can draw it out for you how fluoride is a contributor to cancer, along with all these other chemicals. So get this out. You don't have to have fluoride to have healthy teeth. I haven't used fluoride now in a decade. My teeth are in fact, they're healthier now than they ever were. And then household cleaners. So if you haven't watched our video, we have another one where I went into more detail about household cleaners, but you can swap out your glass cleaners, your oven cleaners, your countertop cleaners with a little bit of, I don't know why I'm drawing a blank. Vinegar. A little bit of vinegar, mix that with some water, a couple of drops of essential oils, and that's your household cleaner. And so if you don't like the smell of vinegar, just throw some more oils in there. Lemon is a pretty popular one.
Yeah.
Thieves.
Yeah.
And you can go on, you know, there's these multiple different companies selling essential oils. doTERRA, Young Living. You can go online and order some clean ones. Just get some clean ones. Start, you know, where you can. I understand that we go through all this and you watch it all and you're like, pfft. So let's summarize it. A couple of the first things that you should do. What's number one? What would you say is number one?
Adjusted.
Get in here. Get in here. Let's just say that you got all this right. Oh, we got to talk about exercise too, Christine. We have time. Okay. Exercise. The best type of exercise being shown for hormones is short, high intensity, which is what we do. We have classes here, 2, 4, 6,
That's
7,
how I
8.
lost almost 20 pounds. I wasn't working out excessively. I was working out 3 times a week here, doing our T3 workouts.
Yeah, so sometimes the workouts are 5 minutes, other times they're 20. But we do it here, so call the office here. Those are all free. They're for anybody that's under your care. So you come in here. What the burst training or surge training will do is it'll shock your body into action. It'll get your hormones starting to rev up a little better versus long distance stuff.
Right.
If you just get on a treadmill for 30 minutes, you're going to have a little bit of benefit. As far as your hormones go, that can actually make your hormones worse. So short duration, high intensity, whatever it is. This morning I got on I have one of these assault bikes, which is a deadly, horrible looking stationary bike thing with handles that do this. If you're a CrossFitter, you know exactly what I'm talking about. And I was on that for 20 minutes, but it was all short bursts of high intensity.
I'm sure you were dripping sweat.
I was dripping sweat. And 20 minutes into that and I was done. So that was my workout for the day.
Yeah.
And you know, my hormones, I haven't felt this, I didn't feel this good when I was playing professional soccer 15 years ago. So short intensity, high, and then sleep. Guys, get a minimum of 7 hours of sleep. Don't listen to anything that's telling you that you need less than that. 7 to 8 hours, great. If you don't get 8 hours or 7 hours at night, take a nap during the day. Sleep is one of these things, if you don't get it, and we've had people in here that don't sleep very well and they're literally losing their mind.
Yep.
Acting just early onset Alzheimer's. I mean, that is a disaster. Don't, you know, give me cancer before you give me Alzheimer's.
Yes, horrible. Yeah.
Give me a hormone problem before you give me Alzheimer's. So just take care of that part. So summarize real quick. Get adjusted. Contact us. We have specials all the time. This coming weekend, this Saturday, we have, you see all these pretty flowers. Thanks, Joy. Hi, Joy. All these pretty flowers for Mother's Day. We have a special. Why don't you tell everybody what we're doing Saturday?
We are doing a huge discount on x-rays, only $40. So anybody, family, friends, bring them in. $4 x-rays. We'll see what's going on with you. We'll set up that first appointment as soon as we can, and let's get you going.
Yeah, so $40 X-rays this weekend. We have a coupon system that really makes this work. You don't have to worry about any of that. We make sure it's all compliant. For those of you Cairo warriors out there that are saying, how does he do that? We've got all that covered. So you come in, $40 for your X-rays. That's typically the most expensive part on the first visit.
Yeah.
I'll analyze what's going on. We're looking for any kinks in your spine or what we call subluxations, and that is literally what blocks your brain from getting to your body. You have to start there, and then if you could do one nutritional change.
Me personally?
What would you tell them?
Cut out the sugar.
You got to cut it out. If it doesn't fit into the category of clean protein and veggies, probably shouldn't be eating a whole lot of it anyway. If you are fit already, you don't have any weight to lose, you don't have any hormone problems, obviously fruit is a God-given food, berries. But for those of you guys that have big hormone issues, whether it's cycle problems or weight, you've got to keep your insulin level in check. And fruit, unfortunately, raises your insulin, and that is one big player in your hormone world. So you got to keep that in check. Okay, I think that probably gave everybody enough to chew on. You guys reach out to us if you need anything. You got any final thoughts?
No, come see us Saturday.
And we got baby coming, so you're gonna, give her congratulations, her and John. So happy for you.
Thank you.
All right, guys. Hooten Family Healing Center signing off. We're gonna do this every week at least. Eventually, this is gonna turn into a daily show where we record it over brunch time. We'll be we'll be letting you know what time that's going to be.
Yes.
We're going to cover different topics. Whether today was hormones, obviously share this, like it, and then what we're going to do is record the audio version, and then they're going to play it on 100.7 The Word FM at 8 o'clock at night. So you got multiple chances to hear all this. Just stay tuned for the next topic. Christine will plaster it all over social media. Tell your friends about it. You never know how far reaching. You might say something. Like yesterday, we had a lady sick as she could be, rheumatoid arthritis, taking Enbrel, which is one of these famous drugs right now that causes things like cancer. The side effects are horrific. And one of our families here, she's been telling her for months, you've got to go and see him. And finally, she was hurting so bad, she came in here, got her first treatment, and there was so much pressure on her spine that once we got any adjustment in there, once we got any pressure off, she got off the table feeling a little bit of relief and just started crying and thanking her friend for getting her. Share this. You never know who you're going to help. We love you guys. Talk to you next time. All right.